With that, I'd like to recognize the gentleman from California, Mr. McNerney.
The neighbor from California. Thank you, Chairman. I thank the witnesses this morning. Dr. Fauci, how can computational data scientists partner better with microbiologists to accelerate the research?
Well, I mean, computational biology is a discipline that essentially impacts on virtually all of the biological issues we do. So we can do computational biology when we do the sequencing of various strains of virus that come in and that you want to make a vaccine for. In fact, I think in his opening statement, Dr. Jernigan had mentioned the fact that the capability both of the CDC and the NIH to do mass sequencing of a variety of quasi-species of any virus, including influenza, relies on computational biology to be able to get to the next step in developing a vaccine.
Is the symmetry pattern of this nanoparticle significant in any way?
Yeah, I mean, actually what it is that the display of multiple components of that stem create the ability to engage what we call the B-cell repertoire of the immune system, so that the chances of it hitting the B cells that will ultimately respond to give you the kind of an antibody response you want, that's a highly immunogenic approach. And nanoparticle approaches to any vaccine is really the wave of the future. And that's what we're trying to do to get away from the situation of having to grow a complete virus and use that as the vaccine the way we're doing in eggs. Here you use recombinant DNA technology and you show the immune system only that part of the virus that you want it to respond to, and you avoid all of the other distracting immune responses. That's why the scientific community is so excited about those new technologies.
On the issue of more rapid production of influenza vaccines, new synthetic messenger RNA vaccine technology may expedite vaccine production. These mRNA vaccines do not require the isolation, adaptation, and production of viral vaccine stocks like the current egg and cell-based influenza vaccines. Weeks to months may be saved in vaccine production. This time savings may allow the late production of seasonal influenza vaccine strains when a mismatch occurs between circulating influenza viruses and seasonal influenza vaccines. Similarly, the production time for 600 million doses of pandemic influenza vaccine may be reduced from 6 months to 3 months and become available before the pandemic peaks. As added value of messenger RNA vaccines may be a faster and easier way to distribute and administer these vaccines. Many messenger RNA vaccines are encapsulated in liposomes or nanoparticles, as Dr. Fauci stated, and which may intrinsically have adjuvant properties and the ability to administer vaccines transdermally, hence trading a syringe and needle for a self-administered patch. None of these innovations and discoveries will make it into the influenza vaccines of the 2020s without immediate and sustained multi-year funding and authorities to NIH, BARDA, FDA, and CDC to execute with industry partners the pandemic plans of yesterday and today. Your continued wisdom, generosity, and support have carried us this far. Help us finish the journey. Thank you.